Hey everybody, I'm Dr. Richard Stevenson and I'm the Director of Education at Stevenson Dental Solutions. I'm also Emeritus Professor of Clinical Dentistry at UCLA. And this is our teaching center where we conduct many hands-on courses all year long. Hey, now before we get started, I'd like to make a brief introduction about a product that I personally use to manage my practice. It's called CareStack. CareStack is an all-in-one cloud-based platform designed for the U.S. dentist that wants to run and manage their business without the need for multiple software subscriptions to put pressure on your bottom line. CareStack provides all of this functionality to run the contemporary dental practice in one cloud-based solution. If you'd like to learn more, scan this QR code and book a brief demo with one of their specialists. Thanks, CareStack, for sponsoring this channel. Okay, Dr. Stevenson here, and we're going to evaluate a typodont that's been submitted for a mock exam. And the assignment was number 8 PFM and number 19 MO Amalgam. I'm going to give you grading on both these preparations based on system that we've been using for a long time. And when we look at the amalgam, the first thing we do is we look at the outline form and the outline form of the occlusal, and then the outline form of the proximal. The outline form of the occlusal is going to be broken into 3 parts. How well it flows, in other words, the shape of the outline form, where it is positioned on the tooth, in other words, does it follow the grooves easily or evenly, and then finally, is it of the proper size? And so let's start with the shape or extensions, which also has something to do with the size as well. And we can see here that we do have a pit on this 𝐥𝐤𝐤 tooth, which extends in this direction, which was not included. This would be the location typically of a second distal pit. And I would have included this area. So I would have had the little dovetail more of a fishtail shape. So I would have had it go into this area and not into the middle of the triangular ridge of the distal lingual cusp. On the facial, you did a nice job following the facial extensions and the lingual extension. The size is quite nice. If we were to look at the width of the outline form, utilizing an RGS 3-4 instrument, we'll be able to see how wide the isthmus is. And let me show you what that looks like. So this is the 1 millimeter RGS 3, and you can see that it's really nicely in that 1 millimeter range. It's a little bit more here, maybe a little bit less here. Between these two cusps, a little bit more in here, but this one is just right. So I think you've done a very nice job with the size of the outline. In terms of how far you extended up onto the facial and onto the lingual, it appears to be approximately 1 millimeter more than the original isthmus. So if we were to measure the distance from the buccal to the lingual, we'd find that that would be approximately 3 millimeters. And this is the RGS 3, which is 3 millimeters long. So you did a really great job with that. So that would be the size and position. Now let's think about the flow. Does this have nice flow? And I think it does. There's a little bit of a sharp edge here and here on the occlusal portion, but the rest of it has, generally speaking, very nice flow. So I think in that area you did quite well. Let's turn our attention to the interproximal outline form. You can see here that we have the RGS 1, which measures 0.4. And what we'd like to see is that the amount of clearance is about the same as the tip of this instrument. So you can say, oh, that's a little too much. How much is too much? Well, this is the RGS 2, and it measures 0.75. If this fits interproximally on the buccal and lingual, not the gingival, but the buccal and lingual, if this fits, we like to say that you've gone too far. But in this case, it won't fit on either side, so we can feel pretty good about this extension being within the acceptable range. Perhaps not ideal, but acceptable. The other thing you want to look at is the gingival. And the gingival extension, that means the space you have between the gingival margin and the adjacent tooth is going to be at least 0.5 millimeters and probably in many cases around a millimeter. And you're right in that zone. You're right between that probably 0.75 to 1 millimeter range, and I think that that is quite acceptable. That does produce an axial wall height from the pulpal down to the gingival that is, in this case, about a millimeter. We'd like to see that a little bit taller, and that might be somewhat short because of the depth of the pulpal. But let's get back to that in just a minute. Let's refer back to the flow and the way these are angled. The angulation here shows that the angle will be slightly obtuse, and on the lingual side, the angle appears to be very nice. It's a little bit wobbly, but it's pretty nice. So slightly obtuse, pretty much close to 90 degrees or 91 degrees, which is what I like to shoot for, not 90, so that we don't leave any undermined enamel. So I think that the only thing that could really criticize is the sharpness of your S-curve. If we had just made this a little wider right here and extended into this area, I think you would have had a little bit more of a nice flow of the S-curve. So you're being a little conservative on your S-curve. And that really wraps up outline form. The grade for your outline form, and if you consider that this would be 40% of your grade, I don't believe you're going to be getting a failing grade because you neglected to include this, but I don't like the fact you went down the middle of the triangular ridge. So I'm going to give you a grade of 3.0 out of 5 because of the missed area and the fact that you didn't avoid this triangular ridge. You never want to put a groove or an extension into a triangular ridge. You want to go around the triangular ridge, which we didn't really do here. The extensions are a little bit too much, but that would have probably graded you down to a 4, and the fact that this is a little bit abrupt, that would have been a 4. So the reason why you're getting a 3 on your occlusal and proximal outline is not because of anything other than the fact that you missed this groove right here, okay? Now let's turn our attention to depth. So when we talk about depth, we're looking at two different things, really. We're looking at pulpal depth, which is the distance from the cavo surface down to the pulpal wall, and we want to make sure that it's at least 1.5 in all areas for amalgam. This is an amalgam, so we want this to be 1.5 in all areas. Sometimes, if you run the RGS instrument up against one of the walls, it'll show that it's less than 1.5, but not so in this case. This one actually looks quite good. So I think you did a nice job. The only thing I notice when it comes to the orientation of the depth is that you tipped your handpiece towards the facial. So rather than holding the handpiece slightly lingually oriented, your convergence divergence situation places the handpiece off in this direction, which would make you have an error in the orientation of the way the burr was held with respect to the tooth. So I would have had uprighted this area, and then this wall here, rather than being divergent, would have been convergent. But do we lose retention? Not so much, because you do have overall convergence. It's just the way that you got your convergence. You didn't make your convergence perpendicular to the occlusal table. And here's the occlusal table right here like this. You just draw a little line or a plane right across the cusp tips, and you want to make sure that your burr is oriented so that it's exactly perpendicular or orthogonal to that plane. When it comes to the depth of the axial, we like to look at the axial wall from this occlusal view, and axial depth is the distance we take from the outer cavo surface into the axial wall. And ideally, we'd like to be around 1.2 to 1.4. Now this is an RGS 1, and that measures 1.5 millimeters in length. So that means that you're a bit on the maximal side, not quite conservative enough. Another way to check it would be with the RGS 4, which measures 1.5 millimeters in diameter. And you can see that you're clearly more than 1.5. And also, if you notice, there's an angle to the wall. So you're deeper axially on the facial side compared to the lingual side. And we like to try to have that wall somewhat convex in most situations, or at the very least straight and uniform and parallel to the outer cavus surface margin at the gingival. And in this particular case, you can see that it's angled just a little bit. Let's take a look at the convergence of the box. We want to make sure that the non-functional wall of the proximal is straight up and down and perpendicular or orthogonal to the gingival, and the facial wall should be converging slightly towards the lingual with respect to the gingival. So I think you did a pretty good job with that particular situation. So I think overall, in terms of your internal form, the only things that I would criticize would be the depth of your axial wall and your convergence error, divergence error that you had made on the occlusal, where you had slipped the burr over towards the facial when your burr actually should have been leaning somewhat towards the lingual. Okay? And there is some irregularities inside. We didn't quite get the line angles as clean and sharp as we'd like. We also left a little bit of irregularity here on the facial. Sorry, not the facial, but the gingival, which could have been smoothed off. And those areas could have been improved. The pulpal depth is pretty uniform. The pulpal depth is pretty uniform. There's a little bit of a line across here. You can see that right there. So maybe that would be a little bit of a bump right along that area. But otherwise, it looks pretty good. And I don't think that there's much more I want to say about that other than I would probably give this grade on the internal a 3.5 out of 5.0 because of the issue with the axial depth and the convergence divergence error. In other words, not having your handpiece burr perpendicular to the occlusal table. The final area of evaluation is going to be the operative environment. And for that, I'm going to give 20% of your grade in that area. You can see that there's been a little bit of nicking of the adjacent tooth, but it looks like you polished it and you improved it, and that is acceptable. I don't see any marks on the tissue. I don't see any areas where you scarred the gingiva. Boy, there's a lot of damage on this tooth back in here, but that was from a previous procedure. You definitely don't want to have any damaged teeth whenever you submit your grade. I don't see any marks on the tooth, and it really is, the tooth is also free of debris. So I think in the area of the operative environment, I would give this a 5.0 out of 5. So your total average being a 3, a 3.5, and a 5.0 would be somewhere in the area of about a 3.3 to 3.4 average. And this would be a passing preparation. So congratulations. So this is the PFM on the anterior, tooth number 8. And the first thing I like to look at, and there are really 7 views we like to look at, okay? View number 1 is from the facial. View number 2 is from the underside, like this sort of angled upward view. The third view we like to look at is from the side. The fourth view is from the occlusal, or the incisal view. Then we like to look at the straight lingual view, and then we like to look at the distal view and the mesial view. So let's go ahead and take a look at these 7 views and see what we can see. Generally speaking, I think the preparation looks pretty good. We like to see that the reduction at the incisal is approximately 2 millimeters, and you can hold an RGS 4 right here and see that it's a little shy. It doesn't quite get to the 2 millimeters. You're closer to 1.5. So I would have reduced a little bit more off that incisal edge for a PFM. When we look at the taper, I see no undercuts, looks good, but when I look at it from the facial, I don't see enough shoulder. I see shoulder that's probably just barely a millimeter over here, and it's definitely less than a millimeter here. One of the keys to success on a PFM is to see a 1 millimeter shoulder from both the mesial and distal. That always will set you going in the right direction. As far as your scallop is concerned, you followed your gingival area very nicely, very uniformly, except right here you get a little bit subgingival. So that would have been an area that I would have tried to have gone a little bit less. On the distal side, you brought your margin up quite a bit above the tissue, sort of following the normal pattern of a papilla, where in fact this typodont does not have a papilla, so you would want to have that margin closer to the tissue. The line of draw of the prep looks decent. I don't see much of an issue with that. Now let's take a look at the lingual view. Now the purpose of this view is not only to look at the facial reduction, but also take a look at the lingual clearance. So the clearance of the lingual in this case should be at least 1 millimeter. And I try to get the RGS instrument to fit, and it doesn't quite fit. So let me put this here and focus a little bit. You can see that we just can't quite get this to fit in this area. So you're a little bit less reduced than you should be in the ideal situation. What about the reduction of the shoulder? Does the shoulder look good to you? How much reduction is there here? And the answer is it looks fantastic across this area. This is 1 millimeter, but it gets too narrow right here on the distal, as we mentioned earlier. Let's take a look at our third view. The third view is the side view, or you could refer to this as the silhouette view. This is a view that tells us very much, about the way you reduced your facial. And so what we do with this view is we line up the facial area here on one tooth, and we line it up with the facial of the other tooth, okay? And so what we're doing is we're looking for, is this reduction getting gradually more as it goes down towards the incisal? In this area, it should be 1.0, maybe 1.2, but then it should be about 1.25, 1.3, and here at the end, it should be 1.5. So the question is this 1.5? And I think we can clearly see that it did not quite meet the requirements for reduction. The technician is going to have a hard time making a really nice looking PFM here because of the under reduction, particularly in this area between the middle third and the facial third. Let's take a look at it from the occlusal view. And in this particular view, we're looking at the preparation in terms of its taper and draw. You can see that there's a little bit of debris here. I need to remember to mention that when I give you your final grade on the operative environment. But basically that kind of debris really needs to be removed. I usually use a brush like this, either dry or with a little bit of a product that we have called Secret Sauce that cleans things up really nicely, and then it looks a lot better. Does it draw? The question is, does it draw all the way around? And one of the most important things you can do, and you can actually do this in most examinations, you can mark the internal between the margin or the finish line, right, and the axial wall. You can come around this way and you can mark it 360 degrees. You can do this in the mouth. So you can see here on the facial, let me back up a little bit so I stayed in focused. There, right there. Okay, there we go. You can see here that the draw is very, very tight. In fact, I would say undercut. So when you look at the lingual side, it has draw, but the facial doesn't. And then if we tip it this way, we see that the facial has draw, but the lingual doesn't. So somewhere in that preparation on the facial and lingual area, you have an undercut. Mesial distally, you're okay. So sometimes the problem is that your lingual wall is too upright, which I don't think it is. I think you've leaned your lingual wall towards the facial. The problem in your case is this bulge here in the middle of the prep is hiding that margin. So if you were to remove this bulge, as we mentioned in view number 3, we would be able to solve that particular problem. Can we still make a PFM here? Absolutely. The laboratory will have to block out the undercuts so they can fabricate the crown, but it can be done. Let's take a look at the lingual. And what we're looking here on the lingual for is we're looking for a nice uniform parabolic shape that is parabolic from about a 2 millimeter line here. This is about 2 millimeters, and then this whole area in here should be uniformly slightly concave and parabolic in shape. And I think you did a very nice job with that particular aspect, so I'm not worried about that. Let's go ahead and use a little secret sauce here and clean up some of the pencil marks that I put on your tooth. So when we look at it from the lingual side, we're looking for a chamfer. And so what we're looking for is we're looking for a margin that curves and is angled downward. And what I see is something more of a fillet margin or maybe a rounded shoulder. So if we utilize a burr that has a shape that is more towards this type of shape, like this 8878K, this is going to give you the proper chamfer. Half of the depth of this burr will do it for you, but you see how it doesn't really conform to that shape, does it? The shape you have developed on the lingual looks more chamfer, shoulder-like or fillet-like. It doesn't look like a chamfer with a downward declination angle. It's close, but not exactly right. So I would definitely want to use an 8878K 016 to create that particular situation that we're looking for. And then we look at the mesial tooth and the distal tooth, and you can see that we have some scraping and we have some scuffing on both sides. So, you know, there is some damage. It's not a major amount of damage. I'd like to see zero damage, of course. But in terms of the preparation, there's enough going well for this that I think I would probably give it a 3 out of 5 overall. I don't think that you did a good job on the operative environment. We need to be a little bit more clean and tidy things up. But the prep was actually pretty nice. The issue is that you just didn't prep enough off the facial. That was really the big issue. That and over here on the distal side, just not enough axial reduction, not enough incisal. In other words, the prep is a little conservative. In fact, it looks a lot like an all-ceramic preparation where the parameters can sometimes be a little bit less reduction because we're making the material all out of one dental restorative material is used rather than multiple materials. So I hope that that makes sense. I think you passed them both, but I'd like to see you work a little bit more on some of the details we mentioned, and that is that.